Are you preparing to sit Simulated Consultation Assessment, SCA? It can be daunting to sit an exam where it's the first time you're going to sit it, or you're feeling anxiety and you have some uncertainty about this exam. But in this video, I'm going to share with you 7 practical tips that you can use to get your preparation started and hopefully pass this exam. Hi, my name is Dr. Erwin Kwun. I'm on a mission to help doctors lead a fulfilling life. Let's jump right into the first practical tip. Without preparation, you can almost guarantee failing this exam. This is why it's so important that you plan and prepare for SCA early on. Now, some people, they might take 2 months to prep for this exam. Other people might need to take longer, for example, 4 to 6 months, especially if you're working less than full time. So the dates for SCA has already been confirmed. Have a look at the dates and ask yourself how long you would need to prepare for this exam. So if you're going to sit the exam in November, then think about how you're going to organize your preparation. If you're going to give yourself more time and you want to sit it in January, for example, then think about how you're going to organize and plan such that by the time that you're going to sit the exam, you have done everything you could to make sure that you're scoring well for the exam. So preparation is very important. Without good preparation, then you can't just expect that on the big day that you're going to perform well. So it's very important that you prepare and make sure that you embed consultation skills such that when it comes to the exam, then it comes naturally.
Work in early, learn as much as you can, gain as much experience as you can, and then on the day when you're faced with a real challenge, just rely on your instincts and do what comes naturally. And I think that philosophy, I think, also applies to young doctors learning consulting skills for the exam purpose. Yes, it could be funky and lots of instructions and going on in your head in the early stages, reading books about various models and practicing various techniques and stuff. But if you do that nice and early, so that stuff is then internalized and becomes automatic, you can then relax and then on the day you will just find yourself consulting in a nice, friendly, instructive way, rather than having to try to kind of control every word you say, because you're really just not, it isn't quite embedded securely enough.
Tip number 2 is to structure your consultation. It's very important that you study consultation models and learn from each of the models that you think would help you in your consultation. Oftentimes I see registrars who don't have a structure. They take a history and are not focused in the history, and they're not asking questions at the right time, and what happens is that they go back and forth from data gathering to clinical management, or not systematic in their approach. So it's very important that you organize your thoughts, and a structure will help you in organizing your thoughts and knowing in the back of your mind that you've got a framework how the consultation should go and how it should progress. So there are various models out there. There are models such as Calgary-Cambridge, Neighbors. You can have a look at these models and you can borrow each piece that you think is going to help you and develop your own consultation model that fits you. Everybody has their own consultation style. So you need to work on various consultation models and see which one you think would be good for you and take from each of them and develop your own consultation style. By doing that, you will find that when you're consulting, you're more at ease to consult and you know exactly where you are in the consultation and how you're progressing. But if you don't have this structure, then what you find is that you might be asking questions, and if things are going well, then you might be doing well, but sometimes you might miss things and then realize later. By having a model and a structure, then you're going to make sure that your consultation is functional.
It's been my privilege as an examiner and more recently as a tutor on various exam preparation courses to hear the sorts of things that trainees are struggling with when they are finding this difficult. And I think in the early stages of learning how to consult, people can be over-taught. There can be too much instruction going on. Remember when you were learning to drive, the first few driving lessons, you were thinking, pressure on the wheel, which is the clutch, how do I change gear? Don't forget mirror signal, maneuver hands, all that stuff going on. The internal conversations you'll have with yourself, they actually get in the way. And it's really not until that internal noise dies down that you're free to direct your attention more outwards.
Tip number 3 is about asking the right questions. There's various questions that you could be asking. It is helpful to consider various categories of questions. There's open question, closed question, and then there's facilitative question. So open question tend to be good in the beginning of the consultation where you want to get the patient's story out there. So what you want to do is ask the patient couple of open questions to encourage the patient to tell the story, to get the story out such that you understand what's going on. So open-ended question could be, how can I help you? This is something that's where the patient would start telling you what's the problem. Other question that you might ask would be, tell me more about this headache. So you're opening this for the patient. Another open question you can ask would be, how did this headache start, Mr. Smith? So then the patient starts telling you what's been going on from the beginning. Closed question or question where you ask where you might get a yes or a no answer is closed question. For example, did this headache get worse when you bent over? So make sure that you know when to ask open question and when to ask closed question. A common mistake that I see registrars doing is that they start asking closed question too early in the consultation. They think by asking the closed question, they're going to speed up their data gathering. And what happens is that they might need to work harder to get the story out there and understand what's been going on. They find that they're using their time in not very efficient way. So try to get the story out there, ask the open question, and then you can ask closed question later in the data gathering part. But if you try and ask closed question early on too soon, then you might have to work harder to get the whole story, because you've got the flow of the story the patient might want to tell you. So you want to get that patient to tell the story first. If the patient is a poor historian, then you might want to help the patient to tell the story or ask some facilitative questions. For example, you might ask the patient, can you tell me how this headache is? Is it like a throbbing pain, sharp pain, or a dull ache? By giving these options, then you help the patient to tell you more about this headache. So by asking this question, you're not asking a leading question. So you're asking a question where the patient has a choice to tell you, or even they can think about whether this headache is different and they might tell you it feels like an electric shock, for example. So you need to know how to use your questions in the data gathering part, because if you don't do it well, then you're not taking a targeted history. It's very important that your questions are sharp and help you progress in your consultation. It's very important that when you're listening to your patient, you give them your undivided attention. If you're not listening actively, you're thinking about what you're going to do next, or you're preoccupied by what the patient told you, or you're thinking about something else. For example, if the patient mentioned they've been in a car accident, then you might start thinking about your car insurance and you need to pay your car insurance, so you're going on a side trip. It's crucial that you quieten your mind, because if there's too many noises and chatters in your mind, it's going to be difficult for you to tune in and actively listen to your patient. So make sure that you quieten your mind before, so that when you're listening to your patient, you're giving your patient your undivided attention. You're not worried about what to say next, and you're listening to the cues that the patient are telling you. For the SCA, the simulated role player has been given a script. So either telling you something, if you notice a tone of voice that changes, or a cue such as they are citing or seems to be that they are expressing some frustration, then that might be a cue that you want to follow up. So ask more questions and pick up on that cue. But if you're listening and thinking about something else, you might not pick up on that cue. So it's very important that you train your ear to listen actively. Are you enjoying this video so far? Have you found the tips useful? If so, you might be interested to download a free copy of the SCA Blueprint. In this copy, I go in much more detail as in how you prepare your consultation and how to use strategies so that you can increase your chance of passing SCA. Click the link down in the description below to download a free copy. Let's jump right back into the video. Tip number 5 is to prioritize. It's very important that you learn how to prioritize in your consultation. You might come across role plays where the patient is coming with multiple problems, or they've got other things that's complex in the history where you're having to unpick what's the issue and what you need to address today. So it's very important that you train yourself how to prioritize. Don't just prioritize based on what the patient is telling you. You need to be very objective in thinking about what do you think is important, what's urgent, and what needs to be addressed for safety purposes, such that you make a decision with your patient in agreement as in what you're going to tackle in the history. If you learn at 9 minutes that the patient is experiencing problem with the chest, maybe they have some chest tightness, then it's not going to be easy for you to manage this problem at minute 9. So it's very important you try and explore whether the patient's got other problem in the beginning of the consultation. For example, you could say to the patient, I understand you booked this telephone appointment to discuss your headache. Is there anything else you wanted to discuss today? Then what happens is that you're going to make sure that you prioritize what needs to be addressed at this consultation, such that you don't have a curveball that comes towards the end of the consultation where it's going to be very difficult for you to manage this safely. Tip number 6 is to safety net appropriately. A common issue I find registrars doing is when the safety netting is not realistic and the safety net advice might provoke more anxiety to the patient, or it's too vague. For example, some registrar might say to the patient, if you've got any concern, give us a ring back. It's a weak type of safety netting. A more robust safety netting is specific to the problem that the patient is presenting with. For example, you will tell the patient what to look out for, what to expect if this is working, and how to get in touch if there's any concern. For example, you consulted Mr. Smith, who presents with a 2-week history of cough, productive cough, and you've decided to give a course of antibiotic. So you can tell the patient, I expect that this antibiotic is going to improve your problem in the next 2 days. However, if you notice that your symptom is not improving, or if you find that you're starting to have problem with your breathing, short of breath, any chest tightness or any chest pain, then please seek medical advice by calling blah blah blah. So you're very specific as in how you want the patient to seek medical advice. So be as specific as you can and realistic in the way that you're safety netting to your patient. Tip number 7, smile while you're talking. For the SCA, you're not seeing the patient face to face or in person. So you might not be able to have the same energy level when you're seeing somebody face to face. So when you're smiling while you're talking, the patient will feel this enthusiasm and friendliness, and the tone of voice will be more pleasant. So what you want to do is to make the patient feel at ease so that they can tell you the story, you build rapport with your patient and build trust. And when you're speaking with a smile, it is something that patients can pick up, and it's more likely for you to build rapport with your patient easier. Whereas if you're speaking with a monotonous voice or you don't feel like you're caring when you're talking, then the patient might be able to sense that. So that's a tip that I would recommend that you use, and you'll find that it's easier for you to build rapport even if you're speaking with somebody who is on the other side of the screen. If you found this video useful, you might want to watch the next video on remote consultation. I'll give you practical tips how to prepare for remote consultation. Take care everybody, bye bye.